Hi guys, welcome to Daddy Directive. Today we're going to talk about baby spit ups. Why does it happen? When is it a problem? And how to deal with it. You just fed your baby and she seems happy. And you notice something drooling out of her mouth. And it's the milk you just gave her. And soon she is soaking wet in her own spit. And you start to wonder, is this normal? Well, don't worry. Spit up is actually quite common among healthy babies. In fact, for the first 3 months, about 50% of the babies experience spit ups. The formal medical term for it is gastroesophageal reflux, or GER. For the adults, the muscle between the esophagus and the stomach is what keeps the ingested food in the stomach. But for the newborns, the muscle hasn't developed yet. So yes, in the beginning, the baby's stomach is a little bit like a tumbler without the lid. It will spill easily. Now, spit ups are okay and quite common, but it does become a problem when it develops into a gastroesophageal reflux disease, or GERD. This is more extreme in that so much acid is splashed back up that it is painful for the baby. I get frequent heartburn, so trust me, it's unpleasant. So what are the signs to look for to indicate whether it's a GERD rather than a GER? Well, the baby coughs or chokes when the spit up is happening, and the baby is generally unhappy because of the heartburn, and the baby is not gaining weight. Now, don't get too anxious. Like I said in the beginning, spit ups are quite common. The good news is that it will peak around 2 to 4 months and then will start to subside by the time it's 7 to 8 months. And around the 12 months, it should be gone pretty much completely. So other than the anatomy, what are the possible reasons that could promote a spit up? Well, there are mainly 4 common reasons. Eating too much or too fast is a surefire way of having a spit up. There's only so much they can hold, and when there's too much, it will overflow. If you're breastfeeding, certain foods and drinks in your diet could make the baby sensitive to the breast milk and spit it up. So if the baby wasn't spitting up before, think about what you may have had that day or the day before. That may be the cause of the spit up. If the baby is sensitive to cow milk based protein, that may be the reason for the spit up. In such cases, you may want to consider changing to a different formula. Here's a link to a video where I actually talk about different types of formula if you want to check it out. When babies drink fast, they could take in air with the milk as they drink, and this could be the cause for the spit up. Babies drink fast when they're hungry, just like we do. I inhale my food when I'm starving. So, try to be a little bit more cute when you're looking for cues that indicate that your baby is getting hungry before she gets really hungry. There are a few things that you could do to help minimize the chance of a spit up from happening in the first place. You could try to keep the baby upright. Feeding the baby and then keeping them upright for up to about 30 minutes will help with the spit up because you're letting the gravity do the work for you. You want to try smaller portions more frequently. So if you are feeding, let's say 60 milliliters every 3 hours, try 40 milliliters every 2 hours. You want to burp the baby frequently. When the babies are feeding, they take in air, and the buildup of the air could cause the spit up. So the burping would ease that. You don't want to put pressure on the tummy. So don't keep the baby on their tummy after they feed because that could promote the spit up. In fact, keep them on their back, and if you're worried about the spit up, just turn their head to the side so it could drain off to the side. And lastly, try to change the diaper before the feeding, because if you change the diaper after the feeding, inevitably you're going to lift the butt up. That will cause the stomach to be in a higher position than the mouth, and that will promote a spit up. So, when does it become a problem? Well, there are certain signs that will indicate some red flags when it comes to spitting with the baby. If your baby is either not gaining weight, or spitting up forcefully, or spitting up green or yellow liquid, or blood, or has the blood in the stool, or suddenly starts spitting up after 6 months old, you should contact your doctor because that is not normal. I hope I was able to answer some of the questions you may have had about baby spit ups. And I totally get how anxious you can get as a parent sometimes. But don't worry, you are doing great. The fact that you want to find out more about baby spit ups shows that you're doing great. As always guys, thank you for watching and happy parenting.